Turning our attention to Latin America, we see that two health officials from the United States have joined other experts at an Ebola conference in Cuba, in the latest sign of cooperation between the long-standing adversaries. The meeting will be discussing ways to prevent the spread of Ebola in the Americas. The U.S. maintains a trade embargo on the Caribbean island, and the two countries do not have full diplomatic relations. But they have quietly cooperated for years on the issues like public health, immigration, and environmental protection. This is a global emergency, and we all have to work together and cooperate. Nelson Arbadella, a regional official of the U.S. Centers for Disease and Control Prevention, told reporters before the meeting. We'll make every effort to ensure the quick diagnosis of patients to break the cycle of transmission, adding that the meeting in the Cuban capital, Havana, would also discuss planning for training medics. The world is right now applauding Cuba's commitment to this crisis, as Cuba is the biggest single provider of healthcare workers to the Ebola crisis in West Africa, more than the Red Cross or richer nations, the World Health Organization says. It sent 83 doctors and nurses to Liberia and Guinea last week, who joined another contingent of 165 Cuban healthcare professionals in Sierra Leone. The Caribbean nation has been praised for its response to the Ebola crisis, including by the U.S., and more Cuban medics have been trained to travel there. In response, its response has also won plaudits from humanitarian workers who say the international community's reaction has been lacking. A total of 32 countries are represented at the Havana conference, including Mexico, Canada, Brazil, and Panama. With all these countries under one roof discussing this deadly epidemic, surely there will be a concrete plan of action on how the Western Hemisphere could stop the spread of Ebola. Thank you.